Good afternoon. My name is Aisha Gomez. I represent District 62A, the south side of Minneapolis in the House, and I serve as the DFL chair of the Taxes Committee. So if you listen to Republicans, whether in Washington or here in Minnesota, even today in Ways and Means Committee, you'll hear a lot of talk about the national debt, talk about controlling spending and fiscal restraint. Sometimes you'll even hear talk about helping regular people control their lives or afford their lives and control costs as they're increasingly, hit with inflation and other increases in the cost of living. But now they've taken action and we don't need to just listen to their words any longer. Trump and his enablers in Congress have introduced a budget resolution, and it's very revealing. They want to cut $880 billion from Medicaid, the safety net program that ensures that so many Minnesotans, elders, working families, people with disabilities, and 42% of children in Minnesota have the medical care that they need. And why are they doing it? Are they doing it to control costs for Americans? Are they doing it to buy down the debt? No. They want to cut $880 billion in Medicaid for one very simple reason: to give tax breaks to their allies, to millionaires, billionaires, and corporations. And so we have introduced House File 2591. I'm the chief author of it. It's the Medicaid, Not Millionaires Act, and it's a very simple bill. It is a contingent tax rate imposed on millionaires that equals Medicaid cuts in Minnesota. And so, what it says is that we are not going to pay for tax cuts for millionaires and billionaires and corporations on the backs of Minnesota's children or any other vulnerable Minnesotan who just wants to have access to the health care that they need. All right, so we're going to hear from a few folks today. First up is Senator Mann.
Hi, everyone. I'm Senator Elise Mann. I represent Senate District 50, which is Bloomington and Edina. So as we heard, the Republican-led Congress is considering plans to cut Medicaid to pay for tax cuts for the wealthiest Americans, with the House budget resolution targeting $880 billion in potential reductions to federal Medicaid spending. This Republican-led proposal is to take away health care from low-wage and middle-class Americans and give that money to the richest people in this country. I don't know what planet we are living on where anyone, or let me start over. I don't know what planet we are living on that anyone would be so cruel to think that that was okay. I just don't. I don't understand how we continue to applaud the hoarding of wealth, the hoarding of more wealth than any one person could possibly spend in a lifetime, while at the same time we look away as people starve, as people die on the streets, as people die from preventable diseases because they can't afford their health care in one of the richest countries on the planet. Health care is a very basic human right, one that the remainder of the planet seems to understand, while Republican leaders in America still believe that it is a luxury that should only be afforded to the very wealthy. So if the federal government is going to be complicit in this behavior, in this ideology that only rich people should have health care, if the Trump administration is going to allow Americans to die on the streets without health care, while Trump and Elon and his billionaire buddies hoard more wealth than the entire GDP of certain countries, while Americans continue to suffer, then we in Minnesota are going to act and we are going to protect Minnesotans. Because we believe that it is not what is in your bank account that makes you a worthy human being, and we believe that health care is a human right. Under no circumstance are we going to sit back and do nothing while the Trump administration strips away the dignity and livelihood of Minnesotans. So in the event that they decide to go ahead and go through with their cruel budget plans, we are going to ask the wealthiest Minnesotans to step up. We will not allow Minnesotans to fall further into poverty, for crime to increase, for people to go hungry, and for people to die on the streets, while the resources to prevent all of this exists and is abundant. The idea that some lives matter less is the root of all that is wrong in the world. With that, we have Judy Moe and her daughter Raven.
Hello, everyone. My name is Judy Moe, and next to me is my daughter, Raven Moe. While I wear many hats, today I'm speaking to you as someone with a disability who is the mom of someone with a disability, and both of us are recipients of Medicaid, known as medical assistance in Minnesota. There is no way that I can express to you the level of fear that we have been living under due to the projected cuts to Medicaid. In our case, Medicaid makes up 75% of our household income, because for the last 22 years, I have been paid 40 hours a week as a direct support professional to take care of my daughter at home instead of her being forced into living in a group home or institution, which would be more costly, by the way. Without Medicaid, we will lose our medical care, our home, and will not be able to buy food. Many people with disabilities are already unnecessarily living in institutions, group homes, nursing homes, and many are homeless. Think about what will happen if there is no longer Medicaid to pay for people to stay in group homes, nursing homes, and institutions. Where will they go? And don't think for a minute that this will not come back to affect almost all of you in some way. The more people not getting the support they need puts more pressure on first responders, hospitals, counties, and cities. There will be an increase in homelessness, and without a doubt, property taxes will increase if more financial responsibility falls to the counties. We must support bills like the Protect Medicaid, Not Millionaires Act that helps protect children, seniors, people with disabilities, and anyone else who is a recipient of Medicaid. It is not fair or just that millionaires and billionaires get big tax breaks while the most vulnerable people in our communities go without their most basic needs being met. While we are living in fear of what is coming down the pike, this bill gives me hope that there are legislators that care and who are willing to fight for us. Thank you.
Good afternoon. My name is Michael Howard, and I'm a state representative representing Richfield and South Minneapolis, and I represent Judy and Raven. It's my job as their state representative to protect the health care they need to survive and thrive. And this is a plan to do that, to protect Judy and Raven, not the millionaires that are about to get another huge Trump tax cut that they do not need. Every Republican in the Minnesota State Legislature, they have that same duty, to protect the health care of Minnesota children, seniors, and people with disabilities. Because let's be clear, Donald Trump and Republicans are coming for them. They are committing and will cut Medicaid and health care that people need to survive. Saying, ah, shucks, this is a federal government issue, not for us to decide, that's not a plan. Mocking those that have great concerns about what the Trump administration is doing to people, that's not a plan. Sticking your head in the sand is not a plan. This is a plan, and it's a very common sense one. It says, we believe that a slice of that tax cut that millionaires and billionaires are about to get, we should utilize that to make sure that Judy and Raven get the health care they need to survive. It's common sense, but if Republicans disagree, they owe it to all Minnesotans to tell us a real plan, and they owe that today. Not tomorrow, not once the Medicaid cuts come down. They owe it today, and I hope you'll be asking them.
Good morning. I'm Representative Emma Greenman. I represent South Minneapolis, and I used to represent both Judy and Raven, who remind us of why we're here, who remind us why in Minnesota we believe in a we all do better when we all do better politics, that we rise together. And that's for the last a couple of years what we have been focused on, ensuring that everyone in our community has access to healthcare, can live the lives they want to live, can send their kids to school, and can thrive. But since January 20th, the lives and the livelihoods of Minnesotans have been disrupted by constant chaos, corruption, and cruelty of the Donald Trump and Musk administration. And now the Republican colleagues in Congress are proposing an $880 billion cut that you heard to critical services, to Medicaid, to long-term care, to term disability supports. Cuts that are going to fall on and hardest hit our most vulnerable Minnesotans, all to pay for the trillions of dollars of tax cuts to folks who not only don't need it, but are just hoarding it in order to have more while everybody else has less. Let's be clear, what Donald Trump and Musk and the Republican Congress are doing threatens the lives and the livelihoods of Minnesotans. And as we heard from Judy and Raven, as I have heard, and I know the members have heard every day from constituents, from folks in our community, it will be devastating. People cannot live without this care. So let's also be clear, Minnesota can't fill the budget crater that Trump and DOJ and their complicit Republicans in Congress are considering, not just in Medicaid, but across the board. But what we can do and what we must do here is protect the Minnesotans who rely on us, who count on us to live healthy, independent lives. And that's what this bill is about. All session, the DFLers have been trying to get Republicans, our colleagues across the aisle, to focus on that project in front of us, passing a budget that supports Minnesotans and supports all of the Minnesotans that we are elected to represent. It's a budget that continues to invest in our kids, in our workers, in our farmers, in our small businesses, and in communities in every corner of this state. And we cannot do that without dealing with the impact of the Trump-Musk congressional budget cuts that will strip health care, that will strip life-saving support care from 1 in 5 Minnesotans in the state. But when we bring up Medicaid cuts, and this, my colleague referred to it, when we talk about these potential cuts, what we hear almost on cue in every committee I've been in, our colleagues smirk, they snicker, they roll their eyes, they say things like, we don't know what will happen. The federal government is beyond our control. Who knows what tomorrow will bring? But Minnesotans need and deserve better than who knows what tomorrow will bring budgeting. And that's what this bill does, and that's what we have to do. It is our obligation to pass a biennial budget. And we can't just throw up our hands and say, oh, hope the Republicans don't do that, because they're promising to do it. So this bill will say that we will protect Medicaid, not millionaires, and we will protect the folks who rely on us, not the wealthy few and the billionaires. So with that, I think I'll open it to questions.
Do we have any sense of, I mean, I know things are kind of up in the air, but do we have any sense of how much cuts to Medicaid will affect Minnesota's budget? I know that this bill sounds like it's sort of, it's flexible towards that, right? But I mean, do we have any preliminary numbers?
Yeah, so it depends. So first of all, I'm Zach Stevenson. I'm the DFL chair of the Ways and Means Committee in the House. It depends largely on what the federal government does, but it could be $3 to $4 billion a biennium, a gaping hole in a critical service for Medicaid. And I think the question is, who should fill that hole? Who should be responsible for that? Should it be people like Judy and Raven? Should it be the 42% of children in Minnesota who rely on Medicaid for basic needs? Or should it be the richest Minnesotans? And we think the answer is pretty clear.
The other question I have is just, you know, Republicans have said repeatedly no new taxes in the new budget, and obviously there will have to be a little more negotiating this biennium than there was in the last. I'm just wondering, is this the only thing that legislative DFLers are considering in order to make up for these potential shortfalls? I mean, this sounds like, you know, might be the subject of tense negotiations, but I'm wondering, are there any other taxes that might come up?
Thank you. You know, I think that we are facing down both, you know, a big deficit in the out biennium if we, just in the current scenario, and also this sort of looming threat of these cuts. And in that context, you know, we are going to have to, pressure will build once it's time to figure out how to make up a, you know, $3 to $4 billion hole over a biennium. And, you know, we're not in that place right now, I don't think, with the urgency that you might need in order to be realistically looking at what's ahead of us, but those times will come. And, you know, and so we're certainly ready as Democrats to talk about what it is that we need to do. And you know, we know that, again, when the moment's upon us, it's like the real choices will just be right there. And we're not going to be able to go back into kind of remote, like ideological bunkers and make sort of, you know, absolute statements. We actually are responsible to our constituents like Judy and Raven. And when that time comes, then we'll be able to have a real conversation about what we can do as a state.
To that question, and I kind of hinted at this in my remarks, which is, you know, this is a real plan to address the very real issue of potential loss of Medicaid cuts. And Republicans have said no new taxes this year. That fits really nice on a bumper sticker. That's not going to mean a hill of beans to tens and hundreds of thousands of Minnesotans that are going to see their costs go up or worse. And so it is incumbent on Republicans to actually say publicly what is their plan to address the impending Medicaid cuts. We're here today to propose a plan, but we're also here to be very clear that Republicans owe it to Minnesota to provide that plan publicly. For folks like Judy and Raven who are fearful of what's coming down the pike, it is an abdication of their responsibility as state lawmakers to just throw up their hands and say, we don't have to come up with a plan. They should.
Representative Gomez, it looks like your bill will create another tier for income taxes. Can you talk about the thresholds in that bill, the income thresholds, and then it looks like it's sufficient to offset federal Medicaid funds. How is that calculated? What number is that based on?
Yeah, so it's a millionaire's tax, so the income threshold for the new fifth tier would be $1 million for filers who are married filing jointly, $500,000 for single filers. And we have a number of, I mean, there aren't a lot of like contingent tax rates in state law, but they're out there. And so, you know, it would basically be a matter of figuring out what kind of, you know, impacts the federal decisions about Medicaid will have on the Minnesota budget and coming up with a rate that recoups those costs from that tier of taxpayers.
And I know a fifth tier has been proposed in the past and it's been unsuccessful. So what can be done? What's new this year? What can be done, especially with this legislature, to get this tier across?
I mean, here we are. We're facing down the reality of trying to meet the needs of the people in our communities in the face of, you know, decreasing resources from the federal government. And so, you know, the pressure is the pressure in the reality of governing in this moment. And so, you know, how the kind of terrain will change based on what those projections are is to be determined, but thank you.
So is it just a matter of hope that there will be a Republican that will cross the line and join in a shared committee, or what's the kind of calculus moving forward with this?
I think that, as Representative Howard said, we have yet to see the GOP present any budget response to what is happening at the federal level. And unfortunately, I think none of us want to be in a position where the federal government has been blinking on again, off again some of the funding that we've seen with the freezes and the executive orders, that they're talking about cutting $880 billion of Medicaid. And we haven't even talked about the other supports that many folks who rely on Medicaid are also going to get cut. But at the state, we are the ones who are accountable to our constituents and the folks who rely on these things. And we, as Senator Mann said, are not going to let people die because at the federal level, they have just given up on democracy and an economy that works for people. And so I think that, again, there's lots of time left on on the clock, if you will. We don't even have budget targets, but I think what is important and what continues to happen, and I'm sure every chair here, I'm sure every person has sat through a committee, I'm sure this is happening in the Senate too, every time we bring it up in the context of the committee we're in, we have to budget for this. We have to protect people. We do not get a response from the GOP. I think that they would like to will this away, but they can't. And so this is our serious proposal, and they should come on board, or they should present a proposal that is real and gets real with the Minnesotans who rely on these services about how they're going to cover that hole. Thank you. Thank you all. Thank you, guys.
We send press conference every day.